Well, I think if they're trying to partner with a primary care provider or a hospital system, which is where I think it makes the most sense for them to consider until we have provider status, the biggest challenge that I see is going to be in connectivity to the electronic medical record. The health systems have all the data and all the information, and pharmacy in many cases is on an island. And so it's hard to manage a patient's care if you don't have all the information. So gaining that connectivity, even if it's remote, or even access in a face-to-face environment where you actually are inside the clinic, is going to be vital. And so then that allows you to add to that record and communicate through that mechanisms as well as get information out. So I think that's one big one. I think another big one is partnering with other providers. And so having to kind of think outside the box and build relationships, build trust, and form new partnerships that haven't been there in the past will be important. And the last piece may be legislative. The legislative side, some states have different laws. In fact, all 50 states have different laws, different practice acts. So depending on what the scope of practice for the pharmacist outlines in the law, as well as what the collaborative practice agreement law says in that state, may dictate how much flexibility and opportunity a pharmacist has. So if your state's one that's very restrictive, you may have a huge barrier. If you have a state with very flexible and open laws, then the opportunities may be very large.